Welcome everybody to this final dialogue as part of the Roadmap to 2030 series. This dialogue is taking place during Digital Health Week, and it's co-hosted by Health AI, AHIN, Path, and Correlade. So thanks to our co-hosts for your leadership in taking us through this dialogue. We're going to start. Oops, sorry. I'm going to set out the agenda quickly, just to let you know what you're letting yourselves in for over the next couple of hours. We're going to start with setting the scene a little bit and explaining what this initiative is, how you can take part, and how we're building it out collectively. We're then going to allow get some initial feedback from everybody through a Mentimeter, and then we're going to invite some reflections from our co-hosts. Uh, I'll introduce them in the next slide when we have the photos up. We will then open the floor up to you all for some thoughts and reflections around the objectives we want to set ourselves over the next 5 years, around some collective ambitions we'd like to try and meet, and some potential actions we could do to get us there. Now, some rules of engagement during this particular dialogue. I would like to invite you to introduce yourself in the chat function and tell us who you are and where you're from. Please also use the chat box if you have the chat function if you have any questions, suggestions, or comments throughout. We will be capturing these on an ongoing basis throughout the dialogue. If you want to make a comment during any of the breakout sessions, please put your hand up and we'll get to you. You can use the icon at the bottom of your screen. And please make as many comments as you like, especially in the Miro boards. When we come to that section, we want as much of your thoughts and participation and engagement as possible. If you have any comments that you want to make verbally, please let us know. Or if not, please make full use of the Miro board to share your thoughts and reflections. Now, without further ado, I'm going to introduce quickly our panel. Rado Adrian sorry, I've butchered that.
No worries.
Sorry.
Andrea and Zizi.
Rado, thank you for coming here. Welcome. Um, Jai, I am not sure if he is here or not. He was flying out from the Philippines, and he may be in transit. So I do apologize on his behalf. Carl, welcome, Carl Furry from Path. Lovely to have you with us. And Christy Celentano is with us from Correlade. I hope I pronounced it right. Welcome, Chrissy. Lovely to have you. So thank you all for participating in this dialogue and for sharing your thoughts and reflections further on and leading this initiative. Now, a little bit about the roadmap so that we can contextualize what we're doing here. The roadmap is basically, we were thinking Transform Health is a coalition of over 200 organizations, and we were thinking, how can we accelerate and focus minds and accelerate the progress we're making around digital health as a coalition and as a wider digital health community in the next 5 years? We're in the last stretch of the Sustainable Development Goals. We are in quite a peculiar and singular sort of facing a singular set of circumstances. We'll go into them a little bit later. But there is this global commitment on the table. We are bought into it. Many countries are still there, bought into it. Civil society certainly is. What can we do to really focus minds and accelerate actions to address some of the enabling environment drivers? So we decided to roll out a roadmap. Now, I know there's been loads of roadmaps. We've been roadmapped to death in many ways. This is a program of action to focus minds and to encourage coordinated action and collaboration at the global, regional, national, and subnational level in order to work and progress and unlock some of the challenges that we're facing, leverage some of the opportunities so that we can progress along this digital transformation. We really want to sort of start by building consensus around key priority areas, encourage coordinated action, and again, to strengthen this enabling environment. So through this roadmap, we will set out what needs to change, who needs to act, and how we can work together to ensure that action takes place. This roadmap is located within a broader ecosystem of initiatives that are very important and that are really driving agendas. I'm thinking in particular of the WHO's Global Digital Health Strategy, which has been extended to 2027, and the new one that's going to be developing. We really want that to be an inclusive process and to take into account some of these issues that we want to see taken forward. There's the UHC Action Agenda and the UHC 2030 strategic priorities, and there's the implementation of the Global Digital Compact and other regional and national strategies that have been developed. So we really want to accelerate and encourage those initiatives to progress, not only in principle, but also in practice. So where does the thinking for this roadmap come from? Where did we come up with a set of priorities that I'm going to lay out before you in a minute? Well, we conducted a piece of analysis on the current situation of digital health and the future trends leading into 2030. And it's a very thorough piece of analysis. The report is called Framing the Future, the Current State of Digital Transformation of Health and the Road to Universal Health Coverage. And we're very flattered to have the author here, Chrissy, to take part in this dialogue. And it sets out some really, what we felt are some really key sort of reflections that are meant to encourage people in navigating the current context and the future trends and inform strategic thinking and planning rather than just as some reflections that are sort of a higher level. This is supposed to inform action. Now, this conversation today takes part in a context of a series of dialogues that we've held throughout Digital Health Week, starting on Monday with equity and inclusion and people at the centre. We then looked at national policies, legislation and regulation. We then moved to resourcing and investment, national leadership, management and coordination we touched on yesterday. And today is infrastructure standards and interoperability. Now, we are very aware that all these themes are interlinked, interdependent. But in order to try and explore and give space to really go into depth on specific areas, we decided to parcel them out and to try and open up a dialogue that will enable a more detailed and reflection on this particular set of issues. Now, a little bit about the process that we'll be going to develop this roadmap. Each theme is being developed through consultations. These dialogues are part of it. We will then consolidate all your inputs, the input that we received today, into a document that will bring together all the different themes, and then we will send that out for wider public consultation online next week. And we will close that wider public consultation on the 5th of December. We will consolidate the results and findings. We will then launch the roadmap on the 12th of December and start to work with you, set up mechanisms for collaboration, for exchange, and see how we can, really move this forward. Now, a little bit about this. I'm very sorry about this. The essay that you find in front of you. I tried to develop some key bullet points, but every single point was so interesting, I didn't quite know how to cut it. So the failure is entirely mine for my inability to condense this. But this is a condensed set of points that are developed far more in the report that I would invite you to go and take a look at. Some of the key findings around this particular theme. Foundations of digital health lie in infrastructure. that is interoperable, resilient, and secure. But many systems remain fragmented, relying on donor-driven or proprietary technology stacks and silos, and therefore, they are fragmented and siloed. Many health facilities lack stable power, reliable internet, or sufficient hardware to support digital tools, the basic infrastructure. So we need to prioritize this basic infrastructure, digital public health infrastructure. Interoperability is complex and technical. And sometimes the project planning cycle seems to suggest that we can resolve something in 3 to 5 years. It's much more difficult than that. It takes far more time, and change happens at many different levels. It requires ongoing updates and standard monitoring of applications, programming interfaces or APIs, capacity building, governance, coordination, testing, and guidance. And these require investments. So it's not just about investing in the technology; it's investing in all those things that surround the technology and that ensure that the continuity of that solution in context. Given donor funding caps, it is increasingly important for low and middle income countries, governments to reduce fragmentation and duplication, to scale evidence-based and interoperable solutions, and to responsibly sunset or merge others. And sometimes this is very difficult because very effective solutions, siloed solutions to respond to specific needs have been developed. People are well trained and used to working with those solutions. But as governments are needing to sort of cut back and improve efficiencies, there may need to be tough decisions to be made to sunset certain things while preserving and migrating historical data to build up a system that's much more sort of resilient, if you like. There's also a need to be transparent around the rules, if you like, the rules of the game, such as the policy guidance, the technical specifications, or standards and interoperability, so the private sector and innovators can integrate and align their solutions to national digital health strategies. So that's very important. In order to reduce that fragmentation, we need clarity in terms of those policies, those guidelines, and those operating standards, if you like. There are great examples of countries that have, achieved some great successes when they've strengthened their infrastructure and connected. Their infrastructure is strengthened and connected. Data quality and service delivery improves dramatically. But without sustained investment in power, connectivity, and maintenance, these gains are difficult to sustain. Over the next 5 years, the priority should be to invest in shared, open, and standard-based systems that enable safe, efficient, and equitable data exchange. And these investments must prioritize long-term sustainability, not short-term innovation. That's critical. And ensure that all countries can build the technical foundations needed for the health systems that are connected, secure, and resilient. So those are some of the broad sort of findings of the analysis that was conducted, and hopefully a lot of material for us to reflect on during this dialogue. Now we've taken this and we've identified this as a particular goal of specific goal of this particular theme. By 2030, we want every country should have digital health architecture that is interoperable, secure, sustainable, that connects systems, protects people, and strengthens health system resilience. That seems an obvious one, doesn't it? I mean, nobody's going to disagree with this, I hope. Or if you do, we really would like to hear about it. The challenge is, what does that mean in practice? What does it look like? What needs to happen in order to achieve this? And what needs to happen at different levels across different contexts, and who needs to do what? So the scope and level of operation takes us down that journey. At the global level, we want to advance the use of global standards, digital public goods, and shared frameworks that support interoperability and sustainability, and to promote the use and adoption of these global standards. At the national level, we want to see investment in infrastructure and workforce capacity to secure data exchange, system integration, and digital continuity of care. And at the community level, we want to ensure that frontline health facilities and workers have access to connected systems and reliable connectivity. What we want to see happen, we want shared standards and infrastructure that enable the seamless and secure data exchange across health ecosystems. I would say probably broader than that as well, not just health, but broader government systems. Investments that prioritize connectivity, cybersecurity, and long-term system sustainability. And countries to adopt open, interoperable solutions that reduce duplication and reliance on external vendors. What needs to be prioritized to make this happen? Countries need to develop and strengthen national interoperability frameworks consistent with recognizable global standards, the expansion of reliable digital connectivity across all levels of the health system, particularly in underserved areas, integrated cybersecurity, data protection, privacy, safeguards into all infrastructure investments. We want to foster partnerships between the public and private actors to ensure sustainability and innovation. And this is going to be particularly important as much of the donor funding that was on the table that brought technical capacity to the government's level and supported government is now increasingly off the table. Therefore, technical expertise and support will need to come from maybe the private sector and maybe other sources, if you like. And we want support for workforce development for digital infrastructure planning, implementation, and maintenance. Okay, so those last three slides are, if you like, the basis of the roadmap that we want to encourage reflection on. This would be the program of action, that goal we set ourselves, those changes that we want to see happen, and the milestones that need to be reached in order to achieve those changes. I'm now going to hand over to my colleague, Christiana, to take us through a little group exercise to get your initial thinking on some of these issues, and then we will invite some thoughts and reflections from our co-hosts. Christiana, over to you.
Hi, everyone. Thanks for listening intently. I'm just going to share the Mentimeter link in the chat box. Frank, if you also just want to keep sharing your screen for a second. There is a QR code for those who are accessing via their phones. That's also a possibility. I'll give you about 2-3 seconds to either access it via QR code or link, and then we'll go over to see the responses. 1 second. Okay, gonna share my screen now. All right, let's get this in presenter mode. Present. Okay, sorry, a little bit delayed today. All right, when you were listening to the presentation from Frank, what is one word that best captures your immediate reaction to what you've just heard? I'll give a chance to people to join. I see 11 people. There were more people on the call. If you go back into the link just to join, it would be great to have as many people as possible joining this Mentimeter. Okay, necessary, urgent, urgency, aligned, happy. If anyone wants to elaborate on their answer in the chat box, that's cool too. But loving the words. Can I get at least, we have 11 people online in the Mentimeter. Can I get at least 5 more people? Okay. Needed, necessary. Needed, important, yes. DPI, all right. Foundations. When we say foundations, do we mean like the entity or like the entities, like foundations, and as in like philanthropic organizations, or we mean foundations as in it's foundational, as in it's something that is needed and necessary and foundational to the conversation going forward. If you want to clarify further in the chat box, you can. You don't have to.
Foundational. That was me.
Oh. Okay, good. Foundational. Okay, thank you.
Sorry, I meant to say the foundations of, yes.
Yeah, no worries. No worries. I'm glad I asked. All right, we have 14 people in here. Let's have two more and then we'll move to the next slide. A priority, yeah. Two more. I won't force you. We can't see your answers, so it's completely anonymous. Needed, priority. Okay. Okay, I won't force anyone to answer. We'll go to the next question. So, from 1 to 5, 1 being not confident at all, 5 being very confident. How confident are you that your country, or let's say context, has the infrastructure and systems needed to support digital health at scale? We have 2 responses. And sorry, there's no nuance in this question. It's either you're completely not confident or completely confident. There's no middle ground. Apologies for that. But I think that if you're not, even if you're partially confident, that's not confident. So I think that it's still legitimate in terms of those kind of 2 choices or that binary. All right. 9, I see. Let's get at least 12 people responding. All right. I mean, 3.6 is not bad. It's higher than yesterday's so far. Yesterday's was on national ownership and coordination and management. So that's good. Can we get one more? We'll have 12 and then we'll move on to the next. Yeah, okay. Great. Okay, I'm going to move to the next question. So based on the presentation, what you've just heard, what do you see as the biggest barrier to stronger digital health infrastructure and interoperability? And if you, for instance, feel that it's a combination of a couple, you can choose combination, but then write your answer in the chat. We had a couple days ago, someone, I think it was Jai actually, who was like, actually, it's 2 really kind of core issues that are kind of mutually kind of exacerbating, that one and the other actually the true reason. So it's not just one, it's a combination. So if you feel it's a combination, you can select that obviously, and then write your response in the chat. What 2 elements or 3, but let's keep it to, obviously these are all barriers. But what is like the biggest or the most sort of problematic, basically, in the conversation. All right, we have 10. Can we have at least 13? 3 more people. 3 more people. All right, I'll give you a 5, 4, 3, 2, 1. All right, we're gonna go, okay, thank you. One more. So far it's fragmented, donor-driven, and proprietary systems. Yep. Thanks for the thumbs up, somebody. The combination. So if you think it's a combination, please write those 2 in the box. Okay, I'm going to move to the next. So this is like an open text, so you can sort of do kind of mind dump, sort of brain dump in the space with text. What would help ensure digital health systems are built to last, not just to launch? What would be the element required from this particular sustainable financing? All right. All right. It's okay. I can't see community ownership. All right. Which communities, for instance? Is it when we say community, do we mean like communities in terms of towns, townships, or communities in terms of like groups of invested stakeholders? As in health practitioner is a community, or do we mean like actual communities subnationally? National ownership, financing, all right, strong planning, exchange of knowledge between who, by the way? Who would need to exchange their knowledge or best practice? National technical capacity and resourcing, yes. Detached projects from political figures, persons, and initiatives. All right, so even like detached projects from like the political calendar too, like or election cycles, because countries will have a prime minister in office or a parliament for 4 years. It'll make a lot of like promises and some initiatives and put in place, and then they get elected out, and all that work is gone. So, is that what you mean by detached projects from political figures? Designing with scalability and why did this word interoperability in mind with local financing mechanism guidelines to support coordination from national to community level. I feel like that's a Kirsten comment.
Not me.
Oh, well, it's excellent, whoever wrote it. National technical capacity resourcing, yes. Solutions that are tailored to context and build on what there's there. Yeah. Financial legislation. All right. I'll let, yeah, great. Great. Thanks for all your thinking on this. Stronger planning. Yeah. Okay, last question. So listening to the last two slides of Frank's presentation looked at our proposed ambitions, which we'll get into a little bit more in the next in a later session, but also some collective actions that would realize those ambitions. So based on what you heard, how achievable do you think those are within the next 5 years, 2026 to 2030? And I just want to clarify if it's kind of unclear why I say partially achievable in like number 4 and only somewhat and only with significant changes and collective effort in number 2. And these might seem the same, but one is basically that yes, it could be, but we need to do a lot of work. And 4 is yes, partially, but partially at this current rate. So nothing changes now. We could partially achieve it. Uh, yes, we could achieve it, but only if we worked very hard and we kind of joined our efforts. So that's the difference between those two kind of choices. All right, let's get at least 14 people responding. So right now it's a contest between yes, somewhat achievable, but only if we make significant changes and come together collectively, or partially yes, achievable at the current kind of trajectory. Okay, I won't force anyone to respond, but thank you. Thank you everyone for your participation. Really valuable stuff. Really interesting to see your perspectives. I'm gonna close the screen down and hand it back to Frank. Thanks again, everyone. And we'll have this thinking. We'll consider this thinking as we go forward.
Fantastic. Thank you so much, Christiana, for that. I'm just going to share my screen once again. And then we're going to invite our participants, our co-hosts. I hope you can see the screen. I want to start to invite our co-host to share some reflections. Rado, starting with you, working for Health AI, you're working on some of the most contentious and most promising areas of technology. How do you see this the development of AI in particular and its potential impacts on the way the infrastructure standards and interoperability will function to deliver healthcare across low and middle income countries in particular? Over to you for some thoughts and reflections on that.
Yeah, thanks, Frank. That's really quite central actually, and I think it's nice to have that flip on really not the grounding, but really okay. Now we have that technology capability, and we know that AI today represents a tremendous opportunity for LMICs to catch up on the global health scene and really on advancing and filling the gaps in their capabilities. But for that to happen, um, we really need to have the infrastructure put in place because if you don't have connectivity, you cannot bring AI. If you don't have internet, if you don't have the compute power, you cannot bring AI. So I think we at Health AI we focus on governance for responsible AI, and that narrative doesn't stand if you don't have this infrastructure. That narrative doesn't stand if you cannot break the silos between the different systems. Because, in the Western world, it's fairly easy because you allow strong competition. But in LMICs in particular, you need that collaborative effect because it's not going to happen. All the projects will stall at the pilot level and they won't be able to scale. So really, enabling that infrastructure build is quite critical, and I think we need to integrate that in the governance because when we talk about responsible AI, one of the key component is equity. So if you bring AI solution that only serve the major hospital, then that's not equitable, and that's still disservice of the rest of the population. So it doesn't fulfill the mission of really public health. And at the same time, when you have the system that work in silos, I mean, the other aspect you mentioned was really about setting those standards, and it's still striking, in your study that most of the solutions are locked in and donor driven, and that explains for some reason why they don't scale. And I think it's quite important, when we talk about open innovation, open systems, even if it's donor given technology, and you have the concept of platform. So you can start with something private and privately owned, but it has to have this level of openness. Why? Because when you bring those technologies and when you enable people to build on top of those technologies, then that's when the mix starts to work. But if you keep it locked in, you cannot expand, you cannot serve the population you want to serve. So I think this is really central to the work we do alongside the governance, because it's part of the governance, it's part of the ethical principles we want to bring through our work and how we really support the countries to set up the right legislations. Standard is the last point. You need standards because standards basically they set the level for safety, security, transparency, explainability, and all these criteria that we require for AI. Because again, I like this sentence, when there are issues of public trust, there is a role for standard. And I think that's quite critical. AI is challenging everyone in terms of trust. So I think this is where it's critical to set those standards at national and international level. And we often think, well, there are not so many standards, but if you go to the BSI website or ISO standards and you do a search, you realize that there are lots of standards. And it's interesting to see that, outside of medical device regulations, I mean, we're talking in the healthcare space, outside of pharma clinical trials, where you need to comply to the standards. All the other ones are just, guidelines. And I think it's worth for any innovator to just check this standard and say, okay, what is today's best practice? And what can I take from these? Because this is how you start building the trust you need from the public in AI. So digital health in general, I think AI is a portion of digital health that is the most forefront in technology, and that's the one that causes most problems. So I think standards really plays a vital role there.
Fantastic. Thank you, Rado, for those great thoughts. The importance of trust is essential to that to the whole picture, really. I'm going to pass on to Chrissy. Chrissy, I know you've worked a lot on the operational side for many years for USAID programs, supporting governments, evaluation different programs. And could you talk to us a little bit about the trajectory and how the sector's evolved a little bit, especially in terms of their approach, the approach to infrastructure standards and interoperability, and how you see the recent changes jolting governments and other providers in the sector, and what direction you feel this is going in based on your experience.
Sure. Yeah. Happy to comment. I think that in the past or recent history, there was a lot of focus on bringing solutions into countries to try to solve a very specific health area use case. And many of us have been on the same journey. We've learned that bringing those siloed solutions, uncoordinated investments have led to a lot of fragmentation of data trapped within systems. And so I know over the last several years, there's really been a shift towards focusing on more coordinated investments, bringing together stakeholders, particularly on the public side at a national level, in coordinating governance structures that are helping to make more decisions about what kinds of systems are needed and how those systems should be talking to each other. More and more countries I talk to are putting in place or working on blueprints for health information exchange or digital health architectures. And really a lot more thinking is starting around standards. As Rado said, there are many different standards out there. And so starting to look at some of the global guidance coming out from WHO on the SMART guidelines and other resources, helping countries are starting to think more strategically now about what are the data and exchange standards that they need as part of their health information exchange to be able to ensure that these disparate systems can move data and not trap data. And thinking about what are those key use cases, what are the current landscape of systems in their country. So I think there's been an evolution of thinking of solving one little problem in one place that maybe didn't scale, or had one very specific solution, to looking more holistically at how moving towards how data can really follow a patient across the care continuum, and how we can bring data together across different disparate systems through health information exchange or digital health architectures. That these platforms that the idea is to then ultimately enable data to move and not be trapped, to provide the whole person record that providers need access to provide better care, higher quality care, and enable better outcomes for patients. I think there's been a real shift in that. Policy is still sort of a gap area, but I'm getting a lot more countries asking me, what kind of policies do we need to enable this type of shift towards interoperability and alignment of standards, and looking to digitize programs across their health system. So I think a lot more starting to think, and a lot are looking at Kenya and starting to think about what types of policies do they need to secure and protect data because of sensitivities of health data, and then also, how do they require or incentivize or encourage adoption of digital health tools in the public and private sector, and then even starting to think about how to bring those pieces together, not just public but public and private. So yeah, a real evolution in the thinking, and a lot of countries have made exciting progress, and I think really important is being able to share across those countries what is and isn't working. Interoperability and data standards exchange standards are really complicated and technical. And so I also see a lot of countries like hungry for information and trying to understand how they create a roadmap, and how, set expectations around what do they need, what kind of skills and expertise, how can they build that capacity, create those plans, work with their an inclusive and representative set of stakeholders through a governance structure to advance these types of objectives.
Fantastic. Thanks, Chrissy. A rich intervention there that I won't try to summarize because I'll do injustice to it, but I've captured it all in writing. Carl, I'm going to pass over to you, and I'm going to invite you to sort of build on Rado and Chrissy's reflections. And also, I want to throw in the mix the relationship between obviously the health infrastructure and DPI, and how organizations like PATH are working with infrastructure standards and operability in the context of a move towards pushing out DPI, which is a sort of more foundational agenda. How does that intersect with the health digital health agenda?
A great question, Frank, and very happy to be going third in this space, because I believe a lot of the ground has been set here by my colleagues going before. I believe we're all have positively drunk the Kool-Aid that standards and interoperability has the possibility to really make that change and that impact. What we've seen in health for the last 20 years is it's just been us building our own roads to try and move the meter and move things further on. What's exciting at the moment is, as the DPI conversations start to get more and more positive traction across all the levels, be it leadership levels, governance levels, developer levels, innovator levels, we have the beautiful opportunity to look left and right and come away with the answers of, wait, hang on, we don't actually have to build that particular thing. We can leverage other work that is going on. And I think that's probably one of the hardest things that we're going to have to figure out how to do in health at the moment, is to raise our heads up from just our lane or navel gazing down and look across and see where other investments are happening in digital public infrastructure, and being brave enough to step out and introduce ourselves into those conversations, as well as realizing that some of those conversations may be not as mature as what we've been thinking around. I've had the privilege of being at the DPI Summit this week here in Cape Town, and realizing that there are many teams looking at those core foundational infrastructures purely from a digital perspective. I'm going to jump to something in a second, but ID, data exchange, payment systems, trust networks, really are helping us answer that questions of, can we identify you in a digital world? Can we have a common way of sharing information? My favorite is, can we trust the information we're getting? But the standards and the way that we're doing that and the data models, we as health need to be able to step out and understand how we can fit into that. And that's a conversation that seems to be happening uniquely in each country, as we're not seeing the big step up to say, here are the 3 data elements only for digital ID coming out at the moment. But as we look across these spaces too, something that Rhoda mentioned earlier, standards tend to evolve and showcase and provide those safety and guardrails when we're wanting to move information in a governed way. And I think that's something that we're looking at from the infrastructure space. But taking another step down, it's very exciting that we love the idea of looking at bringing our health data together, harmonizing it to provide care, really pivoting into that patient-centric view. But an area that we need to continually think around as we design solutions is not just the digital infrastructure, but truly the physical infrastructure needed to effect the change that is coming, that we're looking for and desiring. My adage and the analogy that I like to use is, we can have the most amazing sports car, a great new brand new red Ferrari, But if there's no roads that work on it, it's like putting it in the middle of a plowed field. It's fantastic. It's good engineering, but it's not going to go anywhere. And sometimes we need to take a step back and look across the lifespan of projects of how do we make the most impactful changes today while setting ourselves up for the future of tomorrow. And so these are things that I've been thinking about quite a bit as part, as we have the privilege of engaging and working with different governments and organizations, of that intersection of data exchange and interoperability in LMIC settings, where as much as you may want to exchange information, if there's no power, there's no computer at that end of the facility, it's just not going to work. And so we need to take a wider viewpoint of also thinking of how do we bring those realities into solutions designs. Are you accounting for online, offline synchronization? How are you leveraging and verifying IDs with in the health domain with your broader CRVS? And I realize I probably got a little red light flicking here saying my time's running up, but these are exciting things that I could probably spend the next 45 minutes diving into different scenarios, use cases, and would love to get inputs from the panel too.
I think we've no. I mean, this is a very interesting conversation. Interesting that you attended. I'd forgotten about the DPI conference in Cape Town. So it's great to the question was accidental but fortuitous. Unfortunately, Jai is unable to join us today because he's had to catch a flight from the Philippines. So I will ask just another quick round, just a quick response to the things you've just heard from the other panelists. Rado, just invite you to share just a 30-second sort of reflection on what the other two have just said, and then I'll go around each of you to ask you again. You're on mute.
Yeah, sorry. Thank you. Yeah, no, we can see clearly the synergies between all our different activities and the mountain we need to climb, I think, in terms of harmonizing not only the efforts, the financials and the technologies, but also really the approach. I think we always talk about, yes, we need to tailor for each countries because everybody has different perspective and different priorities. That's very, very true. But I think if we just go project by project, that's where we see most of the failure, and we should really have that global, how do we attack the problem? And I think that from what Carl and Christina said, I think it's pretty. Sorry, not yet. So yeah, that's been 30 seconds.
We've all been there. Fantastic. Chrissy, can I invite you to share some thoughts and reflections on what the other two panelists said?
Yeah, no, I think we've learned a lot. We've come a long way in this work with countries. And I think I agree with everything that was said. All these things are important, and it's working with the country and their context, looking at what their investments and assets are, and helping create a roadmap with some of these best, promising approaches for a more sustainable, interoperable health system that, again, helps make the jobs of health workers easier, and make sure that patients' data is accessible at the point of care.
Fantastic. Thank you. Carl?
Right, there we go. I think we've covered it pretty well. I love that point that Christian's made of bringing it down to the reality of what we're trying to achieve. Making data more accessible and improving health for the patient at the point of care. I think so often we bury that lead and we assume it as part of the common knowledge. But in all our projects and everything that we do here, we do need a north or a guiding star to say that's going to guide the answers to the questions and our next steps. And I'm excited that you said it. I'm a little disappointed I didn't get to say that first, Chrissy. So I may attribute that to you a little later. So thank you.
Fantastic. Thanks, everyone. Well, I'm going to pass over to my colleague Christiana to lead us through the next session, where we will invite you to reflect on all participants in this call to all reflect on the Miro board that we have. So I'll stop sharing my screen. Christiana, over to you.
Okay, everyone. So there's a link. I finally, after 5 days, was able to find the abbreviated link and not the novel in which I shared previously in previous dialogues. So that's the link to the Miro board. Once you have clicked there, we'll move over there. But essentially, what we'll do in our next sort of activity or session is we'll look at each of the ambitions that were outlined in the presentation in a little bit more depth, and really calling on and leaning into our co-hosts and their expertise to lead those conversations for each of those ambitions. So I'm going to go over there now. I'll join you there. 1 second. Let me get it all set up. All right. And sharing screen. All right, everyone. Nice to see you here. So this is our emission boards. I'm only zooming out for a second, just to show you the 3 that exist. So we're going to start on the far left here, on the first ambition. That's going to be led by Rado. I'm sure you've used Miro boards before, but you can click on the sticky note of choice and write in your comments or thinking or questions. Or if you want, you can add another. So if you go to the far left here, to this bar, 3rd down is the sticky note panel. You can click another one and add it to the board and add your comment. Okay, so we will let Rado take over the conversation. The first ambition that we see to 2030 is shared standards and infrastructure enable seamless and secure data exchange across health ecosystems, or the ecosystem. So over to you, Rado, please. It's your mic now.
Oh yeah, thank you, Christina. And yeah, welcome everyone to that board. And it's really about getting your perception and your feel, and for us really to drive the ambition we've set here. And the first question really, where I'd like your input is really, are these ambition the right set or not? You know, really just if you can comment, expand which standards really prioritize which element in the infrastructure, is it all private? You know, all these aspects, I think, should it all be public? Feel free to really comment there.
Okay. All right, so let's see what people are writing here. I'm going to zoom in a bit.
Yeah,
So someone says, this is important and requires technical capacity at the national level. Yes. Standards need to be published and transparent for private-public actor alignment. What would that look like?
So that's my comment. So
Yeah.
I am constantly advocating for countries as they're working on their digital architectures, health information exchange platforms, for EMRs, lab systems, pharmacy systems, whatever, all the systems in the ecosystem that the national government oversees. They need to make sure that they're sharing those standards so that these systems can align. Otherwise, you get involved in some data mapping, data translation work. So I think the more transparent countries can be about what standards guidance they have and they're expecting systems to align with, it'll accelerate this process and make it a bit easier to connect systems. And to be able to have private sector actors more engaged in the future. They have systems too. They have patient data. And depending upon what country you're in, there might be a larger proportion of data there, or an equal proportion. So, it depends on the country, but certainly there is still a private sector that needs to be engaged, and they need to be represented in governance structures and have access to data standards so that the technology partners they're working with have an opportunity to align.
Mm. I can jump on that comment, Christina.
Yeah.
I think in many cases, and especially when I take the innovator's point of view, and what Donald Trump says, like, oh, let's remove all the rules and standards. I think when you're an innovator and you go to a country, you expect to have some standards, even local, because at least it tells you where and in what field you can play and what you need to implement. Because if you go there and it's like a black box, you don't have no idea, then you do something and you don't even know if you're gonna plug and get your business. Because private companies, innovators that come to a country they come to do business, not just to settle. So I think that view of having that clarity on the standard you set is important. And I think innovators ask for it as well, because that's what also support the innovation.
I think just building on that a little from my side, with the experience that we've been running with, is there is a financial driver to having well published and accepted standards and shared infrastructure. Because if you are required to build everything yourself, it does cost a lot more and takes a lot more time in these spaces. And I think that's often when we try advocate for the use of shared standards and shared infrastructure uh, in the impact space around changing people's lives. It has a good narrative we're familiar with, but when I end up talking to the teams in the financial aspects and sectors, and given the analogy of it's easier to build a new house in a city where you've got sewerage, power, and roads than having to build your own homestead out on a barren piece of land. There's an adage that we bring into our space, and so for the use of standards, to bring that analogy back, is a great way of saying this is the grid in which we work, and it allows more innovation too, to build on with the local innovators coming to the table.
It's a good example. I liked someone's comment here. We need to be thinking beyond just the health system and consider standards and interoperability across whole public systems to reduce risk and maintain people, I guess, maintain safety and well-being of people rather than just responding to specific illness or injury or immediate need.
Yeah, this is so true. When you take the government perspective, I mean, we're talking about public health, so it's not just healthcare, and that's so true.
Does anyone want to respond on whether the first question around whether this is the right ambition or does it need to be tweaked slightly? I think everyone is giving, a little bit of insight into where there could be some tweaks, but overall, does anyone want to comment on that? David, please go ahead.
Hello, I cannot think of the right wording right now, but I think one addition could be how the standards on these standards and infrastructure is designed in a way that is inclusive, because there is a risk that the standards are created from, as usual, high-income countries or high-tech companies, and then at some point will be the low and middle-income countries that will need to adapt them to them without being, like taking into account the local context. So in the framing, that part of inclusivity, as I said, I don't have it in mind right now, but it will be a good disclaimer to have it that is inclusive. not just from who is participating on those standards. Over.
Yeah, very good point, David. I think when you look at the standards, I think it's always a coalition of really different trades and countries. It's never just one institution that writes a standard, and they take time. But I think enforcing that universality and bringing more stakeholders, I think it's important to have the global perspective.
Nina?
Thank you.
Hi.
So I left a comment in green there about infrastructure and norms and standards being okay, but maybe I have a challenge with the word enable. Enabling in what way? Is it that just because we now, yeah, so the way I look at it is we have a highway, right? We have a train, um, we have a railway between Paris and I don't know, and Brussels. Okay, so and we have trains that can run on those rails. That is what infrastructure and standards kind of mean. Everybody knows how these trains run, and the rails are standard, and we can run on them. But then we still need political will. We still need political will to be able to say, okay, all citizens can easily go from Paris to Brussels with their EU passport. That is the kind of data. The data can still travel on this trail. Yes, now we have the infrastructure. Now we have the standard. Yes, now we agree that data will travel. So because most of the people I see here are civil society organizations, the process to get political will, I think, needs to be somehow incorporated into this agenda, into this ambition. I don't know how that is going to be done, but just saying that because we have the same standards and the same infrastructure will enable seamless and secure data exchange may not be it. I know it will facilitate. I know it will encourage. I know it will be there. It will be at the service of this data exchange, but without clear political will and engagement, it may still not happen. Thank you.
Thank you, Nina.
Yeah, thank you, Nina. That's a great point. I mean, I think this is representative of one aspect of what makes innovation tick and scale. And we often say you need infrastructure, you need a sense of urgency, and you need stickiness factors. And I think the sense of urgency and the stickiness factor, the political drive, I think, is in that side of the sense of urgency, because you need that flame that makes it happen. But the infrastructure, you're completely right. It's not the only element that enables. So I think we are looking at one of the ambitions here. I think we need to note, okay, what is the political, how do we incentivize the political demand and the urgency?
I have a quick question that I wanted to ask, well, everyone really, and this in response to David's comments in the chat. Should we be working data flows across borders, across contexts, across organizations? Data is fluid, and sovereign states are static in a sense. They're clear borders. We know where they are. When you cross them, you're in a different country. How do we manage a 19th century configuration like a nation state and institutions that are working that with the 21st century assets like such as data, that's fluid and just doesn't stay in one place? Do we need to establish standards that are global in character, that are mutually compatible and consistent, so that data exchange across border can happen in a seamless manner? Or should we be establishing standards that are ripe for context and respond to particular country necessities? I'm throwing that out for consideration and for reflection.
I'm just going to quickly jump in and say that a lot, even more than the standards, which are important, is the data sharing agreements and policies and the trust between countries. Because when you leave national borders, that presents a whole different layer there that needs to be considered. And I think that there is a lot of the standards that people use are from like global standards development organizations. And so while there might be variation in countries like version and you choose this over that, a lot of them are globally accessible. And I was also just going to make a plug for some work that the Inter-American Development Bank and PAHO are working on. In the LAC region on the Pan American Highway for Digital Health. And I think they're looking heavily at the International Patient Summary, but they might just be an interesting initiative to look at for cross-border data exchange, because we know that there are use cases, particularly around vaccination and migration and things like this that do necessitate, or there's a real opportunity to look at some cross-border data sharing. And standards is a piece of that, but even more so is the governance and the policies and the data sharing agreements and things like that.
Kristen had her hand up first and then Carl after.
Yeah, just maybe picking up a little bit on that and on Frank's comment. I think you raise a really, really important point, but I think all the more reason as well why the need for there to be kind of those robust frameworks governing how data is collected and used and shared. And particularly, as you said, it is crossing borders, people are crossing borders, diseases are crossing borders, but then without the right kind of particularly legal frameworks in place, then there are, or kind of data sharing protocols, et cetera, there are increased risks then, because the standards might not be the same in different countries. So I think that kind of makes, while there is, really important to maintain data sovereignty, national sovereignty, I think all the more reason why kind of regional and global collaboration is quite important to try to kind of harmonize on a minimum standard that is required, so that as data does cross those borders, the same kind of protections are in place in different countries as well. And that will then kind of facilitate a more secure data flow, that so that data is, can be used to promote public benefit, improved health outcomes, et cetera, but then that there are those protections in place around people's data and to uphold their rights, and supporting that even if there is, if it is crossing borders, et cetera. So yeah, I think there is a role to play, while recognizing, maybe also going back to David's comment about context appropriate. So it's not necessarily a one size fits all solution, but I think there are opportunities to have a certain level of standard, and a harmonization around that. And then obviously kind of within the national context, tailoring to the specific context and needs.
Building on
Thank
the
you,
back
Kristen.
that, I think what's not much more to add outside of some really good examples of where this is happening at the moment. And so many on this call are probably well aware of the work that the World Health Organization is doing around profiling standards and the content within it to better enable portability of data. And if you're not familiar with that, please do reach out or have a look at the SMART guidelines, works, and initiatives there. We're also seeing an interesting move to really the democratization of a patient's data and enabling the patient to actually carry their own data to move things forward. So I'm glad we're raising the IPS, the International Patient Summary. which is a good structure to put things in. I think it's getting that agreement on the codification, and what we put into is going to be just as important. And more so than that, what we're really excited about at the moment is the provenance of data. We often forget that not every digital system should be allowed to submit and contribute and consume data within the health space. We have huge regulations about which information systems are able to engage with our financial data, which is just money, but we don't really care who touches our health data, which is our livelihoods. And from that perspective, so a positive challenge to us as a community is to really hold that authority in question of, is this data true? Uh, is it something I should trust? Passports are good examples. That's an authoritative piece of information allowing you to move across borders. Are we bringing the same rigor of thought into our health data we're moving around? And with the trust networks, which is part of what the DPIs are doing, what the WHO is doing, is quite fun to start looking into these areas. So some examples here that I'm not expecting the teams to remember, but all I would say is if you're ever in the position working with your countries or your implementers or as an innovator, this is not a road you walk alone. There are many teams looking at this, and the worst thing we can do is run the race alone in this space. It's better to bring it together so that we can actually move things across the borders.
Great. Rado, you had your hand up, but I see Danielle's now. Did you take your hand down, Rado, or
Oh yeah, take it down. Yeah.
okay. Danielle, over to you.
Thanks, Christiana. I wanted to add in a piece of this discussion around the, I guess, context appropriate standards and infrastructure, because I think resilience is another piece that we need to factor into that context appropriate piece. So it's even the best design standards will fail in practice if the infrastructure that supports that data collection, exchange, use, etc., isn't resilient. And I'm thinking about that particularly right now in the context of Jamaica, as the hurricane has hit, and many of our health facilities are facing power and connectivity issues. And I'm seeing that as well with the typhoon in the Philippines and Vietnam, etc. And it's made me think, how do our data collection and sharing standards hold up in these offline or disrupted contexts? And maybe we should also be thinking about data portability and local backups when the infrastructure itself is unstable. So I think that's another context to factor in, because we are seeing that increase in some of these natural disasters across the world. And that's going to be that resilience piece would be a core focus of the infrastructure and standards being able to hold up.
What a fantastic example. Thank you. Rado, do you have more questions on this ambition?
I think when we look at all the points, I think it's pretty enriching, the ambition one. I mean, even I thought, okay, is there anything missing? But I think everyone's added little patches here and there of consideration we need to bring on top of that.
Great. And I guess we've already sort of touched on it and what needs to happen. I mean, the last question is about whether this is feasible or whether this is achievable. And I think that generally the opinion is yes, but there is a lot of work to be done, it seems.
Yeah.
So I think that we've come to like a natural kind of like organic close of this discussion. If we wanted to move over to the next board, which is the next one to your right, if you shift over in your own screen, has these beautiful aqua colored sticky notes. And the ambition that we'll be unpacking in the next 10-15 minutes is investments prioritize connectivity, cybersecurity, and long-term system sustainability. And the lead of this dialogue or conversation is Chrissy. Over to you, Chrissy.
Great, thanks so much. We'll definitely invite folks to start making comments based on your reflections of this ambition. And I think in particular, starting with what this feels like a mixed bag to me. So I think there's an opportunity to strengthen and clarify this particular aim, and would love to get feedback from folks on, first, does this feel right? But also, how can we make this clearer? How can we make this stronger? What else might, what belongs here? And so we'll give folks a moment to kind of think and start writing. Because I think I'll just keep talking. One of my, as I read this, investments, prioritizing connectivity, sure, that's certainly important. Cybersecurity is certainly important. And then long-term system sustainability, I'm not actually sure what we mean by that. And so maybe we could collectively define this better. I'll pause and let folks.
Interesting reflection, Christy. So I think long-term system sustainability is what needs to happen after the project comes to an end, after you've set it, you've set the system up for it to be maintained. So it's all these updates, technical skills and capacity to provide the updates and to manage and maintain them, system maintenance, system coordination, and the possibility of integrating it with new systems or new technology as it comes on board. All these things that ensure that the system doesn't atrophy and fail because an external donor is no longer bankrolling this again.
So that's like project level, system specific, not the broader enabling environment, or say like an exchange platform that's the connector for all of these individual applications.
Well, it would be that as well, I guess. I guess it would be the need to embed that in this in order to make it sustainable, but also the upkeep and the maintenance of that basic infrastructure, I guess. Does that make sense?
Kind of. Yeah, I'm interested. Thanks, Frank. That's a helpful reflection. Would love to hear from others any reactions or how we could clarify or strengthen this. Kristen, I see your hand up.
Yeah, maybe just to build on that, I think you raise a really good point, Chrissy. And I think having joined the dialogues every day, I think it's really clear that they are not standalone pieces that need to happen. But it's very much the different themes and different ambitions. Many of them are very much interlinked. I think it's maybe a challenge to the team and to all of us is thinking this through of how we reflect those different linkages and showing this as kind of a cohesive picture. And it's not an invest in our prioritization in one thing because that very much is related to another. So I think this is maybe something that good for us to reflect on, because I kind of see some buckets. I can kind of see connectivity here. We discussed it a bit on one of the other dialogues. I could also almost see the infrastructure and connectivity coming together as a piece as well. So but I think it maybe just really makes that case that all of these pieces need to happen together. They're
interwoven.
They're very exactly.
Yeah, no, that's helpful. David, I see you're saying on sustainability, ensure that governments are not locked into a single provider. So maybe having the right terms and conditions for ownership. Or is there anything you want to add to that? I don't know if you've also put it in a sticky note, but if you want to build on that, that would be helpful.
Yeah, thanks, Christina. Yes, I did, and it's actually what you just mentioned. It's like the systems are secure, but then the governments own that digital health system, and it's again normally what happens is it gets locked to a single provider, and it's usually very expensive, and you basically depend on the longevity of that provider if the system is going to keep working or not, and the price is set by that monopoly that you kind of create. So that needs to be taken into account. And as you mentioned, it could be on those terms of reference and also how the infrastructure is made that is easily transferable to other providers. Of course, me saying these comments without having the technical knowledge of how this actually works.
No, those are great comments. Appreciate your perspectives. I see some others writing, so I'll jump into those. But maybe as we're kind of going through these, if folks aren't already thinking about, it'd be great to also sort of add some commentary on, like, you know, what are practical approaches to accomplish this aim, or you know, how can we support countries and their partners in making these types of priority investments. So I'm going to just see what others have said. Okay, so Danielle, you're saying that resourcing needs to be provided to ensure ongoing investment into system updates, maintenance, right? So I think what you're saying, Danielle, and feel free to jump in, is making sure that when we're scoping and budgeting for systems, that we're thinking beyond piloted implementation, but actually operations, maintenance, and enhancement, like the full system life cycle. Is that what you mean there? Or did you want to build on that? If you'd like to jump in, Danielle. Oh, sorry, I'm calling on people. Sorry, Christiana.
Oh, please, no, Danielle, I'm sure you have more to add to that.
She's currently muted, so if you want to jump in, feel free. If not, we can keep jumping around. And feel free to raise your hands if folks want to jump in.
Carl had
Carl?
a comment and then lowered his hand in a unashamed demonstration of humility there, Carl. We want another metaphor.
No, I think it's Dan had some great points, and they'll come up in the next point a little bit more. So I'll hold back for now.
Oh, fantastic, thank you.
Okay. I'm seeing comments about money. Yes, it does require money, but also sustainability, thinking about those policy levers and governance structures that, you know, continue that representation and commitment. Lizzie, I see your hand up.
Yeah, so maybe just to add on, because this really touches on another comment I made in one of the other dialogues, that what we've realized within the global south is after Trump's bold move, they realized that domestic financing is something that we really have to make sure it's intact. So, and what normally happens with African governments is if it's not a priority for them and if they don't have the buy-in, then we're completely wasting our time. So I feel like despite this ambition being, number two, I would want it to be number one, but I know Christiana wasn't intentional about that. Ideally, investment it's crucial, but for the global south, especially the African continent, if the government buy-in is not around, digital health or connectivity, then we're completely wasting our time. So when it comes to the CSO space, we're trying to see where the government soft spot is, and we lean more on advocacy around that and pushing them towards domestic financing. Now, the entire continent, we're just talking about domestic financing. So now is when we're taking that opportunity to kind of push our own agenda, like, having digital health principles and policies in place and giving digital health, light of the day. So I just needed to reiterate that because it's like a blanket discussion ongoing within the continent.
Mm-hmm. Yeah, that's a really helpful and important reflection given the current environment. And so thinking about that ownership and sustainability from the lens of what can a country own and support financially and resource, and that, I think that always goes back to when you're designing the project, what's the use case, what's the system for, who's going to fund it and support it, and like within your context, what is actually sustainable. So that's a really, really helpful comment. Danielle, I see your hand up as well.
Yes, I was trying to come in earlier. I think my computer froze, but
no worries.
Just to say, I agreed with what you were saying, because the question becomes, how can we make our systems resilient, and actually, or the standards and infrastructure that we develop, how can we ensure that it's actually fitting for the reality on the ground and not just the ideal that we have in our heads. And that's also why I think a lot of this investment definitely has to be, country specific and context specific, because we're dealing with different environments that change quite rapidly. So that investment in long-term system sustainability becomes a core piece. And I think as we think about investments as well, it's not only, financial investments, we're also looking at what are the human resources needed to sustain this for the long term.
Great, Thank you for adding that. How do I see your hand up?
Yeah, I'm just throwing something to think of, and really just taking the example of AI again. When you look at the need of data for AI to create the models or to validate, I think when nationally you don't have enough data, I mean we see those coalitions. So what's the regional coalition strategy that we can put in investments? Because we are talking about big money for infrastructure, and we are talking about the risks, you know, countries going into wars and all these then putting that mindset of, okay, what can coalitions do? And I think it's just a question I'd like to throw here. Is that an avenue as well? So it's not just national, but supranational coalition between different countries. If you look at the Zazibona, so Zambia, Namibia, Zimbabwe, they have a coalition in terms of how they work together in what was that for in their approach to I think it was initially on medicines validation, and then they try to expand it on digital health. So I think what can be done at that level of investing in the infrastructure, connectivity, cybersecurity. So open question to you all, and if you can pop some notes there, if this is considered, if you see that an avenue that should be considered or systematically integrated, would like to know your thoughts about that.
Great. Thanks for posing that. Sounds like if folks want to add in some sticky notes to share their perspectives, that would be helpful. Carl, I see your hand up.
Thanks. I'm going to go back to the previous one. Yeah, as a lot of the conversations have been moving around, something that's really stood out to me is to consider these investments and the prioritization of connectivity, security, and sustainability under that real total cost of ownership. In if we're looking to achieve a particular outcome, that's a key language there. Not I'm looking to purchase a particular system. It's what are we trying to solve, and to consider that total cost of ownership in solving that objective, or in the business world, understanding what that business process is that you're trying to leverage or make better through linking to other systems, digitalization, and so forth. I think that starts to sum up a lot of the thoughts of the really where the cost is, how do you keep that going? Because in the end, governments carry the responsibility to provide those services, not manage the software. And we'll talk about that a little later too. And I think it also gives you a vision and an objective to stage the investments and to see where the overlaps are that we need to give real context to why cybersecurity is so important, especially if you're doing anything around trying to curate vulnerable populations. It's just people's livelihoods. Maybe we'd want to secure that. There's never been an example on anywhere in the globe where that's been a problem, having that data leak out. Please note the dripping sarcasm of my South African humor there. So I think it's something really good to think through, and I'm glad to see there are some points, some cards here around looking at the return on investment of it, highlighting what we're trying to achieve, and not looking at the software, but the objective itself, and how the investments in connectivity, cyber, move towards the sustainability side.
Yeah, that's a great point, because there's sort of the total cost of ownership on what does it cost to buy, run, maintain the system. But then on the flip side, the return on investment, more about lives saved or whatever, accessible where it needs to be to do the service to improve the outcome. So more outcome, out oriented, that it's not always about necessarily saving dollars, but it's about saving lives. Frank?
Yeah, no, I mean, great reflections all round. What I was thinking as I was listening to everybody, I was not so much the why cybersecurity, but the how. Do many countries have the capacity and capability to provide cybersecurity for the data of very sensitive data of patients at national level? We keep hearing about data sovereignty, which is an aspiration that's great, laudable in practice, but when you say, but do you trust the let's say the Mali government to hold your data in a safe and secure environment and not to have data leaks, rather than maybe a external provider like I don't know, AWS or something. Then the question of data sovereignty becomes a slightly more nuanced. So I'm just wondering how this question of who pays for it, who does it, how do we trust it, who controls it, and do we come back to the legislation and regulation and in a sense to get to ensure that trust economy is maintained in a globalized sort of system. I don't know if I'm making sense here. I'm just also thinking that we've also heard a lot about data in relation to, and we know in relation to pandemics, that in relation to security matters. Data is and health data in particular is a defense issue as well as a kind of public good and stuff like that. So there is an apparent contradiction or tension that hasn't quite been resolved, and that requires maybe a different framing and a different paradigm underpinned by trust.
Mm-hmm.
I don't know, I'm just throwing that out for.
That's great, Frank. I think that's great to raise. And definitely if folks want to add some more sticky notes thinking about that hosting question, and also the cybersecurity, how to secure and protect data and provide at a national level like guidance, and then practically speaking, like tactically what can be done within systems. I think that's kind of what you were getting at. If we could get a couple folks to add some ideas on that, give us some more food for thought or approaches, like tactical approaches, I think that would be super helpful to move some of that conversation forward. Sorry, and there was still a hand up. Nana?
Yes, please. I hope you can still hear me.
Yes.
So I've been listening, and the thought keeps coming back to me. I think since the past 4 days, that sustainability in investment in infrastructure has been coming back at every of the conversations. And I just wanted to share. I worked for some time in the digital sector, and I believe that in going forward, the more we blend the digital health into digital infrastructure, I think the more secure it is. I wanted to share that when we're talking about how to ensure trust, there is something that countries do. They call it, it's a law that declares a set of infrastructure as critical national infrastructure. Critical national infrastructure to the US is like the NASA, it's like FBI, it's like the physical building where you have these military headquarters. Those are, basically they are high security zones. If you get drunk and you drive your car in there, you are going to jail. You're not going to be jailed for being drunk. You are going to be jailed for national security, that kind of a thing, national security breach. So I think a few countries are upgrading the digital infrastructure to critical national infrastructure. I think electricity in Nigeria and fiber, broadband fiber is now classified as critical or national infrastructure. What does that mean actually, beyond it being a high security area for the country? It also means that taxation on it has to be studied. For instance, I remember working in Ghana in some years back. If you're digging through to have fiber pass through two state lines or two different zonal lines, this zone will tax you, the other zone will tax you. There were so multiple taxes. But once a country upgrades digital infrastructure to critical national infrastructure, it means that it is now dealt with at the national level. So as an investor, you are going to be taxed only once. As an investor, you also get some national security around you as you do the work. So I'm just putting this down since, like, again, as we are CSOs here, we need to accompany the ambition with advocacy about the importance of digital infrastructure to digital health, and why these should have a national security, their national security status upgraded. That's just my thinking at this time. I've seen this in Africa, and I believe that if we, I know that hospitals, national hospitals are already classified as national critical national infrastructure, but I think that we should remind governments that this is also part of digital on one hand and part of health, and investments in that area should be prioritized. Again, if you recall, investments in the digital area are being made by private sector and not often by government. I'm done.
Great. Thank you for sharing those comments. I think Frank was capturing some of what you said, particularly around the advocacy piece. But if there are other aspects that you haven't already put into a sticky note, it would be great to make sure we have the spirit of what you were just saying, because I think that is really, really valuable from your personal experience. I don't know how we're doing on time. Were there any other folks that wanted to jump in and speak to what they put in their sticky note, or just other reflections based on the conversation that you want to share?
Feel like it has come to a natural end. This has been great. Thank you, Chrissy. Very dynamic, lovely. I think we're good. I think we're good on time. If we want to move to the next ambition with these lovely rose-colored sticky notes on the third board, our ambition here is that countries adopt open, interoperable solution. Okay, thanks, Lizzie. Interoperable solutions that reduce duplication and reliance on external vendors. And Carl's leading this discussion. Over to you to Carl to open it up.
Thanks. And I have the privilege of having had the team go before and really get you into the energy of we're looking here. So I think the questions are similar. Does this resonate with you as an ambition that we're striving for? And there is a bit of a positive question there around the concept of open in this arena, not always open source, but open architectures, the ability to plug and play. So we'd be very interested to hear your thoughts. Does it resonate? Is it something that we should be advocating for, or is this something that is quite well ingrained and we should focus our energy elsewhere? And are there some things that you think are going to jumpstart the opportunities to see more of these ambitions achieved? So please feel free to put the post-its in. We'll start looking through them. If there are any questions on the side, please raise your hand or put in the chat.
So Lizzie has started off the conversation with saying that duplication came up yesterday as well. We need to align on national level. Do you want to expand on that, Lizzie?
Yeah, I was looking for my unmute button. Yeah, so ideally what we've come to realize, and I think this came out, if it's not yesterday or the day before yesterday, from UNICEF's feedback, that we realized, and this of course is after Trump's move, that a lot of things were being duplicated. We were doing so many things in different counties, especially like in my country, in Kenya, different districts, same innovation, but in different areas, and we don't even know who's doing it. So that idea of connecting what's going on and just avoiding duplication would have really saved us a lot of funding and even scaled up a lot of innovations. So I feel like, yes, that is key. Reducing duplication would be something that would be like a great ambition. But I feel like then that means we need to centralize everything that we're doing. And that's why, as I had mentioned back in my country, if you're trying to come up with any sort of solution or even donor funding programs, it has to align with the national directives. If not, the government will not allow you to proceed. So they've realized that they've been doing a lot of a lot of donors, especially working with CSOs, have been duplicating efforts instead of, kind of pushing an effort forward or making it more sustainable. You end up starting from scratch. And this was because of lack of data and that connectivity of knowing who's doing what and what exists already in the market and what needs to be scaled up instead of being duplicated. Yeah.
It's a great point on that, and having had some of the experience with the global goods work and the trying to advocate for that, it is unfortunately a known problem of what solutions are out there is one question, but I think more than that, if I'm hearing it correctly, is so who's doing what, and how do you not repeat the actual activity of trying to solve a problem in a key area, in 4 or 5 unnecessary duplicative organizations or initiatives, but rather look at harmonizing that and finding a space to work together. I do see there is a question in the chat here, like what vendors are we looking at here? And I think that's a great question. Yeah, external vendors is a very relative space and comment. So, Nana, do you want to maybe come off and ask the question with a bit more context, and we can think about clarifying it and how we'd adjust the aspects for the ambition? Sorry, Frank, and then I'll go to you.
Yeah. So I think 2 months ago I was in Botswana, and there was a medication, a crisis in the health sector because emergency medicines were missing. Were not just there in the country. And I had some time to chat with the minister and the president of the Health Informatics Association. And so I was just wanting to say, are we looking for uh, data vendors? Are we looking for vendors, infrastructure or service? What are we looking for? Because the explanation that I got from the government, I don't want to say the minister, let me just say that, is that so the government itself depends on vendors. And these vendors are sometimes external with a in-country presence. And the by, like we are saying now, they have evolved their system to have this one system that is hugely dependent on this one vendor. And then this vendor decides to play the government rough, decides to raise some costs just because they have that lock-in. And the government is like, no, this is not how we work. And they're like, yeah, this is what the market is saying. So anyway, basically, it was a tussle between the government and the major vendor. That's why I want to ask, are we looking for vendors in what areas? Are these critical areas where we should, even if we should have interoperable solutions and whatever, but the government needs a free hand. Because what happened in Botswana was that the government's hands were tied to that vendor. So I'm just trying to get some clarity about remaining open, but also being flexible so that governments do not get tied by vendors. I'm done.
I think thank you. I think it comes down, and Frank, I'll hand to you in a second on this one. It's a great question, and I don't think we're going to qualify it here, but it does come back to the point we had earlier about that vendor lock-in of how, and to reframe that language is how tied in are you to a particular service provider, and what is in the broader market? What are your options to move out of that space? And that for me brings it down to a governance question within the organizations, or the governments and the institutions, to understand how they are carrying the responsibility for owning their own information systems, whether it is a service agreement with a third party who carries the responsibility of providing a service, whichever way that is, but also what is the pull in case of emergency to be able to move between different providers in these spaces. It's a great risk identified. I think it's something that we are trying to positively call out the need for countries to think through how you manage your risk, because not many African governments that I've had the privilege of working for can carry a full software development team strong enough to build quality software, and often rely on many different partners. But how you govern that's important. Frank, you've been very patient as I've gone through them. The hand to you, I've seen your hand there.
No, no, this was great. In fact, my question was very, very much linked to this discussion. I was wondering if the underlying premise of this ambition is correct, that countries, in adopting open interoperable solutions, will in fact reduce duplication and reliance on external donors. Do they have the technical capacity and the resources to make full use, to fully adopt and make full use of open interoperable solutions? And I just wondered, I just wanted some thoughts and reflections from the co-hosts and others on whether, in your experience, this is an accurate, the assumption is correct, or whether, as Nina suggested, this dependence on a donor is not a bad thing as long as the rules of engagement are, you know, well established, based on a relationship of trust, and clearly out there.
It's a great question, and I'll speak from a personal experience and opinion here, and happy to have it positively engage with. Is just because the technology is open source doesn't make it inherently sustainable. And this comes from my positive and unfortunate experience. If you look at it, of curating close to 50 different global good technologies in these areas, we often make the mistake of thinking that the product is free, but actually it's the bricks that are free. You still need your own architects and builders to build your own house in that space. And this is where I do believe the donor industry for the last 20 or 30 years has created a false narrative that these products are free technologies. They're not. You still need to curate them. And I think that brings us down to really, how do we bring that ownership understanding into the governance structures? There are initiatives around open source project offices to make sure that understanding is there. But I think the language we chose here with this ambition is not, by design, not open source, but open in a sense of the ability to have access to your data and interface with it. So in such a way that is standards driven, because sometimes the best thing you can do is pay the license fee, because it'll be cheaper than trying to run it yourself. And then sometimes the worst thing you can do is pay the license fee because it's too expensive and you could build it yourself. And that's where that total cost of ownership needs to come through from my personal experience there. But I'd love to hear from the other teams on board. Christina and Robert, the team, any experiences or positive critiques of agreements, disagreements with that?
I'll jump in. I was just going to say, I feel like it's really context specific. And I always advocate for starting with, what problem are you trying to solve? Like, what data do you need for what workflows, for what use cases? Start with your scope and your requirement. I've seen a lot of places where they're saying, oh, this software is being offered to me, or like, oh, everyone else is using this, so I want this. Oops. And I don't think that's a great starting point. I think you really need to start with, what are you trying to do and why, and then take into consideration the different contextual factors within your country. Like, what sort of technical capacity do you have? Are you able to transfer something to be owned and operated by government, or are you not? There's just so many considerations that make a decision for what's a good fit for a country, and it's definitely not a one size fits all.
Great,
So
I agree with you.
how could we change this ambition to reflect that nuance? If we're setting ourselves this as a kind of end goal, this seems to be, how can we sort of ensure that it recognizes
I think there's a different ambition that's coming out here, or an additional aspect in it, because I wouldn't personally want to override the fact that we are encouraging countries to consider open, interoperable solutions that are able to, reduce duplication by interfacing with each other, and bringing other teams on. But happy to hear if anybody's got some really good magic wordsmith to add.
what would be the fourth ambition, Carl? I've got a box up there.
I would say, consider a full total cost of ownership to support the outcome and the multiple scenarios to make the best decision. And I think this is not just true for open source technologies, but also there is a cost in interoperability to understand it. This is going to sound strange, but every line between two boxes on a whiteboard, you should draw with reverence and probably $100,000 price tag. We'd see a lot more simplistic data structures. But there are times where inserting technology for technology's sake is just a bad idea. And you can get away with a lot less. But there are moments where with the duplication we're trying to avoid is something we should really analyze, and understanding that we don't need to rebuild this because we are able to leverage it in different spaces. So there is a balance, and this is where your health enterprise architects and designers come in. Those who are abstract from having their own technology to vend to provide an overall solution, I would recommend. I'm looking at the time, and we've got a lot on the screen here. I just want to check in with our positive moderators and team. Do we want to go through a few more cards, or can I hand back?
Well, actually, I just have a little comment on that. And again, AI. I'm using AI in many of the, in terms of technology sovereignty. I mean, you see ChatGPT and you see lots of countries getting into the race, and you have national or supranational, again, coalitions to build their own LLM. And I think this is something, going to your line, that yes, we can leverage existing solutions, but at some point there is also that debate of sovereignty, and do you want to build your own capacity for that? And when you look at the example in Switzerland, this national program, well, federal confederation program is really based on open source model, so that you accelerate the rate of creativity and innovation. And eventually, at some point, when it's consolidated, then they lock in a bit more. So that's also a paradigm maybe that we can, add into that debate. But there is that sense of sovereignty, and you need to invest, and you can start with open platforms and that to really accelerate your pace, and then really close it in. I mean, you need to secure it. We're talking about digital health solution. There is always an element of control. So you never integrate an open source solution because you don't have control on open source solution. You always need to version and lock it when you deploy it for healthcare, especially if it's a medical device. But having that control mechanism, release the brake, pull the brake, release the brake, that could be an approach maybe to consider.
I think you've put your finger on so many good things in that statement there, and we could spend hours on it. But that break and the moment in time, you said something that I want to make sure we all heard is, especially if it's a medical device. And I think we often forget that software is and should be treated as close to that as possible, because it is curating that information. And even more so now with AI, as you're calling out it, because it's providing so much guidance. So that I think is so important when we look through those. But also you mentioned something there that I think is so valuable to consider with the evolutions of information systems here is, where do open source software solutions fit in the evolving ecosystem? Sometimes they give you more freedom to understand your requirements and how technology fits within your business process flows, because you're not paying an overly expensive license fee. But you may get to a point where your requirements are fully enough understood, where the next step is to procure something that gives you the enterprise governance, accreditations, the red phone on the desk if something's going wrong, to run with. So I think we're positively bleeding out of connecting with interoperable solutions and duplications and reliance on external vendors, but moving into what I would start looking at, that quality view, that anything we do in information systems needs to be treated probably as if we're trying to create medication. And because it
I'm sort of reminded of the standardization of time. Before, each kind of region, country, even between Liverpool and London, there were different times, and and everybody was very happy with their local time. You set a time, you met, and everybody turned up. But when you had to go from London to Liverpool, developing a timetable for the trains became a nightmare because they had different times in Liverpool and London, let alone trying to organize a meeting or or a time across countries. And then they standardized it all. GMT, everybody used it. The French are really upset because they thought that, they probably felt that they had to start zero there. But, you had to start counting from somewhere. And, that became the norm. I wonder to what extent the standards and the kind of, solutions in the digital space will become standardized to an extent that everybody feels comfortable with, trust they're working, and will abandon this like sort of idea of control in exchange for trust that it's working.
I personally think we're 2 decades away from that. Rightfully so. I think we shouldn't worry about the technology, more understanding the data that we need to provide the care. The data we use to make the health decisions today has evolved from what we did 10 years ago. The codification language is still evolving, and just as we're seeing the introduction of innovative new technologies are changing the way digitally enabled healthcare is provided, such as AI. What we're doing today is very different to what we were doing 4 or 5 years ago in this area. And I did, Frank, see the very great little link you put to time there, and I have noticed we're coming up to the top of our last 5 minutes. Whether that was an intentional or not, I maybe just hand to my fellow panelists for any 30 seconds of closing thoughts as we go through it, and then we'll hand back to the Transform Health team to wrap us up for the afternoon. Righto, since I see you on screen, maybe you want to chip in and comment on the thoughts before we hand over.
It's going to take more than 30 seconds. Hold
Go for
on.
it.
I think.
All right, Christina, maybe we hand to you then for a second.
Yeah, sure. No, I was going to say this is a great discussion. I think we're definitely moving in the right direction and learning from what we've done in the past and continuing to sort of learn and grow in how we do this. And I always come back to it's always country specific. I think you really have to understand the country environment, what are the different conditions you're working with to make some of these decisions. And certainly there is a lot of value in looking at open source solutions. But I think it's starting at that design stage. What do you need? What's the problem are you solving? What are those conditions that you're working in to make a sustainable, long-term sustainable decision?
Great. Right. Any closing thoughts from yourself before I ask our team, Transform Health team, to take over?
Thanks, Carl. You did so great. You preempted our last piece or ask to the co-host. Thank you so much for doing that. Over to Frank to bring it on home. And it's amazing because all the other dialogues have sort of gone over, but I think we'll actually have things wrapped up in time. So Frank, over to you to bring it to close.
Fantastic. Well, listen, this has been such a rich and dynamic conversation. I really want to thank the co-hosts for your leadership and expertise on this. And I really want to thank all of you participants on the call. I noted 38 participants, dropped off a little bit recently, but we had such a rich set of interventions and reflections. We will now go away and consolidate all of this. And we will send it round to all of you again in a more consolidated form. As Kirsten mentioned earlier on, these particular issues and themes are interconnected. So looking at them in isolation is a little unfair, but I think what it has given us is a rich and much more nuance, if you like, depth of reflections and considerations that we can really go away and consider further. So I want to just thank everybody for taking part in this dialogue. We're closing this dialogue today series and this first phase. You will be hearing from us again. Thank you so much to the co-hosts again for your leadership. We will be in touch with you with the feedback and the responses. And I wish you all a very nice and restful weekend whenever you get to it. Thank you so much, everyone.
Great. Thanks a lot.
Thanks.
Bye.
Session.
Thanks all.